What if forgetfulness, fatigue, or even tingling in your feet wasn't just normal aging? What if those strange little symptoms were actually warning signs from your body, signs of a vitamin deficiency that's far more common than most people realize? Vitamin B12 deficiency is quietly affecting millions of adults, especially over the age of 40, and the symptoms can sneak up in ways few expect. Vitamin B12 is essential for many things: memory, nerves, red blood cell production, even balance and mood. But when levels drop, the body doesn't always wave a red flag. Instead, it whispers. People feel tired, foggy, off balance, or forgetful. Sometimes they think it's stress, or age, or just a bad week. But the truth is, low B12 can mimic serious conditions, even dementia, depression, and heart issues. The good news? It's one of the most treatable and reversible deficiencies, if caught early. Let's take a closer look at what causes vitamin B12 deficiency, who's at risk, the unusual symptoms to watch for, how to get tested, and how to fix it. So what exactly is vitamin B12 and where does it come from? Vitamin B12 is a nutrient that comes almost entirely from animal-based foods like meat, fish, eggs, and dairy. That's why people who follow a vegan or strictly plant-based diet are more likely to develop low B12 levels, unless they supplement. But diet is only part of the story. Even if someone eats meat and dairy regularly, they might still be low in B12. That's because in order to absorb B12 properly, the stomach needs to produce enough acid and a special protein called intrinsic factor. As the body gets older, stomach acid production naturally declines, making it harder to absorb B12 from food. That's why older adults are at increased risk, even with a balanced diet. In fact, studies show that up to 20% of people over 65 may have a B12 deficiency, and many don't know it. Who else is at risk? Several groups are more likely to have trouble with B12, even without realizing it. These include vegans and vegetarians, because B12 isn't found in plant foods. People over 60, due to decreased stomach acid. Anyone who's had bariatric or gastric surgery, like weight loss surgery, which reduces the stomach's ability to absorb nutrients. People with autoimmune conditions such as Hashimoto's thyroiditis or type 1 diabetes, which can be linked to something called pernicious anemia, where the body attacks its own ability to absorb B12. Pregnant or breastfeeding women. Their bodies need more B12 to support baby development. Heavy drinkers, since alcohol can damage the lining of the stomach and interfere with absorption. And importantly, people taking certain medications. The most common are O-metformin, a popular diabetes medication, O-stomach acid reducers like omeprazole, pantoprazole, esomeprazole, ranitidine, all of which can reduce the body's ability to absorb B12 over time. If any of these apply, it's smart to keep B12 levels on the radar. Now let's talk about symptoms, and they're not always what people expect. The signs of B12 deficiency can be subtle, strange, or mistaken for something else. Here are 7 key symptoms to watch out for. 1. Memory issues and forgetfulness. Many people start misplacing keys, forgetting appointments, or feeling mentally foggy. In some cases, untreated B12 deficiency has been linked to reversible dementia, meaning it looks like cognitive decline but can improve with treatment. 2. Fatigue and low energy. Feeling tired all the time, even after sleeping well, may be a sign of anemia, which often happens when B12 levels drop. B12 is needed for the body to make red blood cells which carry oxygen. Without it, everything feels harder: climbing stairs, walking long distances, or even staying awake in the afternoon. 3. Shortness of breath and pale skin. Because of the anemia, people may feel winded more easily or notice a pale or slightly yellow tint to their skin. The heart may beat faster to make up for the lack of oxygen in the blood. 4. Tingling or numbness in hands and feet. This is a classic symptom. B12 is critical for maintaining the myelin sheath, the protective layer around nerves. When that starts breaking down, people often feel tingling, burning, or numbness, especially in the feet and toes. 5. Mood changes and depression. Low B12 can affect neurotransmitters in the brain. Many people with deficiency experience mood swings, anxiety, irritability, or even full-blown depression. This can go undiagnosed or misdiagnosed for years. 6. Balance problems or dizziness. Because nerves are involved, people with low B12 often have trouble with coordination and balance, or feel lightheaded for no clear reason. Sometimes they start to walk differently or bump into things more often. 7. blurred vision, or changes in eyesight. In rare cases, B12 deficiency can damage the optic nerve, leading to visual disturbances or even contributing to age-related macular degeneration. These symptoms don't always show up together, and not everyone experiences them the same way. But even one or two of these signs is reason enough to check in with a healthcare provider. How is B12 deficiency diagnosed? The good news is it's usually easy to find out. A basic blood test can measure vitamin B12 levels, but it's even better to check two additional markers. Homocysteine, methylmalonic acid, MMA, both rise when B12 is low, even if the standard level looks normal. Many doctors now recommend checking these markers to catch early or hidden deficiencies. Blood tests may also show changes in red blood cells. In B12 deficiency, red cells tend to grow larger than normal, a pattern called megaloblastic anemia. If a test shows an elevated MCV, mean corpuscular volume, it may be a clue. Sometimes low B12 goes hand in hand with other deficiencies, like folic acid, iron, or vitamin B6. That's why it's important to test broadly before starting treatment. Taking only one supplement without knowing the full picture can actually make things worse. So what about treatment? Can it really be reversed? Yes, and that's the best part. Vitamin B12 deficiency is one of the most treatable health problems, as long as it's caught early and managed correctly. Treatment depends on the cause. If the deficiency is due to diet, for example in vegans or people with low animal food intake, oral B12 supplements are usually enough. These are widely available, inexpensive, and easy to take. If the problem is with absorption, like in older adults, people with autoimmune conditions, or those taking acid blockers, oral supplements may still help, but some people need injections to bypass the digestive system completely. These shots deliver B12 directly into the bloodstream and can be life-changing for those with severe deficiency. Dosage varies. Some people may need high doses initially to restore levels quickly, followed by smaller maintenance doses. That's why treatment should always be guided by a healthcare provider. There's no one-size-fits-all dose. And while it's a safe vitamin with no known toxicity, it's still important to get tested, find out what the body actually needs, and monitor progress. How long does it take to feel better? Many people start noticing improvements within a few days or weeks. Energy often comes back first. Memory and mood might take longer. Nerve-related symptoms like tingling or numbness can take months to heal, and in some cases, if deficiency goes untreated too long, some damage may become permanent. That's why early detection is so important. What else can help? B12 works best in combination with a healthy diet rich in protein, iron, and folate. Staying active and managing stress can also support recovery. And anyone in a high-risk group, like older adults, vegetarians, people with digestive issues, or those on long-term medications, should consider getting tested once a year, even without symptoms. Here's a quick recap. Vitamin B12 is essential for memory, energy, nerve health, red blood cells, and mood. It's found mainly in animal foods. Vegans, older adults, and people on certain medications are at higher risk. Common symptoms include fatigue, forgetfulness, tingling, balance problems, vision changes, low mood, and anemia. Testing involves blood levels and markers like homocysteine and MMA. Treatment is usually simple and effective, either with oral supplements or injections, depending on the cause. And in many cases, people feel dramatically better once B12 levels are restored. Now it's your turn. Have you experienced any of these symptoms? Are you part of a risk group? Have you ever had your B12 levels checked? Leave a comment below and share your experience. You never know who it might help. Don't forget to subscribe to the channel for more helpful health insights, and click the bell so you'll get notified whenever a new video is posted. Your body is always sending messages. Learning to recognize them and take action can make a world of difference. Take care, and remember, a simple vitamin might be the key to feeling more like yourself again.